Today I wanted to talk to you about the diagnosis of acute and chronic hepatitis by seeing a lab report. Okay, so I'll be just briefing it out. I would suggest that you get a basic idea about what are the antigens and antibodies that occur in hepatitis. This is a code to come to a conclusion faster. Okay, so this topic in my UG days I never used to understand. I hope I can make this clear to people out there, okay, to students like me. Fine. See, first we'll talk about the order of appearances of antigens and antibodies if the patient has hepatitis. Alright, guys? Okay, so remember this code SEMA. Okay, S here stands for HBs antigen, E stands for HBe antigen, M stands for IgM. IgM means it is an antibody formed against a particular antigen, HPC antigen, but just forget about that. Just remember that IgM. Okay, IgM is seen in hepatitis, and A stands for acute hepatitis. Okay, you will get to know once I complete this. It'll be easy for you. Now I think it'll be a little vague, but in 10 minutes I think you'll be able to quickly diagnose if it is acute or chronic hepatitis. So remember the code first. SEMA, S for HBsAg, E is HBeAg, M for IgM, and A means acute hepatitis. So I'll tell you what does it mean. See, it is the order of appearance in the blood of the patient. The first to appear is the HBsAg. Okay, after that it is HBeAg, and then the antibody IgM. So if you get all these, then it is a case of acute hepatitis. This much clear? Okay. Now remember one thing, the patient may or may not have HBeAg. Okay, this HBeAg is a marker of infectivity. So if the patient has got high amounts of HBeAg, then we say the patient is highly infective. That means if it is positive, okay, HBeAg, if it is positive, we say the patient is very infective. If HBeAg is negative, we say there is less infectivity. This much clear, guys? So if we get these three parameters, it is a case of acute hepatitis. Okay. Now, in the place of IgM, if you get IgG, then it is a case of chronic hepatitis. Once again, in the lab report, if you see IgG, okay, in place of IgM, if you see IgG antibodies, guys, it is a case of chronic hepatitis. Now, in this case, suppose you got IgM, okay, in the lab report. Okay, the diagnosis is acute hepatitis. Next, what do you see? You see for HBeAg. See, if it is positive, the same rule. Then the patient is highly infective. If it is negative, the patient has low infectivity. Alright, guys? Now let's see few examples. Okay? Go in this order, guys. Alright, I have copy pasted the code for you here. Okay, so first you see, is HBsAg present? See, in this example, HBsAg is positive. It means that, I'll write the interpretation here, okay? It means that, yes, the patient is suffering from hepatitis. Clear? Next, what do you see, guys? You have to go for HBeAg. That you see. See, HBeAg, is it positive? Yes. That means if it is positive, what did I tell you? The patient is highly infective. Okay, what do you see next, guys? You see which kind of antibody is present. Is it G or M? So let us see which antibody is present. See, it is IgM antibody that is present. Okay, so if M is present, then it is a case of acute hepatitis. So what is the final diagnosis, guys? The final diagnosis is acute hepatitis with high infectivity. Let's go to the next example. Again, we follow the same order. Okay, so this is a code basically. SEMA is a code. Okay, first you see if HBsAg is given. Okay, so this is a parameter of this is a lab report of the patient, guys. Okay, so first what do you see? You see if HBs is present, HBsAg is present. Is it present? Yes. So definitely the patient has hepatitis. Okay, now what do you see, guys? You see for E, HBeAg. HBeAg is present, which means I told you if it is present, then it shows you that the patient is highly infective. Okay. Now what do you see? You see which antibody is present. It is G or M. See, it is IgG antibody that is present. If G is present, it is what? A case of chronic hepatitis. So your final diagnosis will be chronic hepatitis with high infectivity. I hope this is clear. We'll go to the next scenario. See, again, this is a lab report. First, what do you see, guys? If HBsAg is present or not. See, HBsAg is present, so definitely it is a case of hepatitis. You can see HBsAg is present, so it is a case of hepatitis. Next, what do we see? If HBeAg is present or not. Okay, HBeAg, sorry, this is anti-HB. HBeAg is negative, right? So if it is negative, what is your interpretation? The patient has low infectivity. Okay. The third thing, what do you see? If the patient has IgM or IgG, right? So if it is G, it is what? Chronic period of hepatitis. It is a chronic hepatitis. If it is M, then it is acute hepatitis. But look here, guys. You can see both IgG and IgM. In such a case, remember, if you see both IgG and IgM, your diagnosis is that the patient had hepatitis, but now he is in the recovery phase. Alright? Let's go to the next scenario. In this case, all parameters are negative, guys. In this case, all parameters are negative except for anti-HBs. You see this HBsAg is negative, anti-HBc, the rest all the parameters are negative. But what is positive? Anti-HBs is positive. This is a case of immunity. An immune person will show you such a result. Like you and me, anyone who is very immune, and see, it's usually seen in people who have taken vaccine. Okay, vaccine against hepatitis, they'll be immune and their anti-HBs will be positive. And you should know that the normal value of anti-HBs is more than 10 international units per ml. Actually, see, 10 is the lower limit. It should be at least more than 10. It comes in the range of thousands. This one you should know. All right. So if you see only anti-HBs in the lab report, it means that the patient is immune. Okay. Let's go to the last scenario. Okay, this is an interesting case, guys. Look at the parameters. Again, here you see all the parameters are negative except IgM. Here only IgM is positive, the rest all are negative. Okay, I'll tell you the interpretation now itself. Here, this means it is a window period. It means that the patient is infected, but then he's not showing any signs and symptoms. The virus, the virus is sleeping inside the patient. Okay. If you suspect that the patient is having a window period, you must check this value, IgM and DHBC, because if you check for HBsAg or any other parameters, they all will become negative and they will show you what, guys? They'll show you false. Actually, it is false negative. I mean, the patient has the virus, but all the parameters become negative. This condition occurs only in case of window period, and if you suspect window period, you must always check IgM of the patient. Okay, the immunoglobulins, IgM, when I say IgM, these antibodies are formed against HBc. Okay, guys, so remember this is in brief about how to interpret your lab results if you suspect hepatitis in a patient. Thank you.